This video will give you tips to support your loved one with CLL and help manage the emotional impact of the disease on them and those around them. Your loved one has been diagnosed with CLL. This is a type of blood cancer that begins in the bone marrow. It starts with a change to a type of cell that fights infection, called a lymphocyte. Over time, the uncontrolled growth of CLL cells in the marrow leads to an increase in the number of CLL cells in the blood. As a caregiver, one of the most important things you can do is to talk honestly with the healthcare team about the symptoms that your loved one is experiencing. When speaking with the doctor, it's important to tell him or her exactly what is happening. For example, what symptoms or side effects is your loved one experiencing? For how long and how regularly are they happening? What makes them better or worse? How bad are they? Are they getting in the way of daily activities or regular life? What should you do to help? It may help to keep a journal that you can share with the healthcare team. Understanding the emotional effects of having cancer can help you better support your loved one, those around them, and also yourself. Feelings of fear, uncertainty, denial, anger, guilt, stress, anxiety, loneliness, isolation, sadness, and depression are all a normal part of the cancer experience, and caregivers are usually the main source of comfort and emotional support for their loved one. Some tips to help you comfort your loved one are to listen actively by giving them your full attention and making eye contact. Never judge, just listen. Restate what they've said to show you're on the same page. Allow them to express their fears and concerns about what's going to happen. Listen when they want to talk and respect their need for privacy when they don't feel like talking. Make sure they know you'll be there when they're ready. Don't say, "I know exactly how you feel," or compare them to other people you know who have had cancer. Every situation is different, and you cannot know what they're dealing with. Don't forget about yourself. Being a caregiver can be very difficult and stressful. Caring for a loved one can be rewarding, but it can also be associated with significant caregiver burden or stress. Caregiver burden has been referred to as the extent to which caregivers perceive that caregiving has had an adverse effect on their emotional, social, financial, physical, and spiritual functioning. As a caregiver, usually the demands put on you are bigger than the resources available to help you cope. You may become responsible for many elements of cancer care without preparation or training. All the effort that takes can have an effect on your quality of life. Caregiver responsibilities can include bathing, transportation, medication management, and monitoring for and managing treatment of side effects. You may feel like you weren't well prepared for this role. It's been shown that as a caregiver, you're at higher risk for things like depressive symptoms, sleep difficulties, fatigue, or maybe neglecting your own health. You may also find your emotional well-being, social and family life, or finances are impacted, that you feel burdened in the relationship, or that you feel a loss of control over your own life. While you're busy taking care of someone with CLL, you may not realize that your own health and well-being are suffering. Pay attention to your stress level. If you're feeling overwhelmed, sad, irritated, or worried all the time, getting sick a lot, or gaining or losing weight, or turning to alcohol or substances, you may want to talk to your doctor about the stress you're experiencing. He or she may be able to help recommend ways to help improve your health and quality of life. One of the most important but often forgotten tasks for caregivers is caring for themselves. Your physical, emotional, and mental health is vital to the well-being of the person you're caring for. To be a good caregiver, you must be good to yourself. Taking care of yourself can include things like asking for and accepting help when you need it, focusing on what you can do instead of what you can't, setting boundaries, finding support from others and connecting with them, and setting your own personal goals like getting proper sleep and nutrition or staying active. Also, watch out for negative habits like drinking too much or using other substances to cope. Caregivers play a large role in the day-to-day care of a person with cancer, and one example of that is dealing with medications. During CLL treatment, your loved one may have a number of different medications to take at home. To get the most benefit, it's important that medication is taken exactly as instructed. There are ways you can help your loved one remember to take their medications as directed. Some ideas are to create a schedule or calendar together. Set alarms or phone alerts for them as reminders. Organize their medications on a weekly basis. Purchase and use a pill organizer. It's very important your loved one take their medication as directed, as often as directed, and for as long as directed. Sometimes, though, they may miss doses or resist taking their medicine because they feel hesitant. You can help by trying to understand the source of this feeling by asking questions and empathizing, and then helping them find solutions so they can change this and take their medications properly. Change is much more likely to last if your loved one sees the benefit and comes to the decision themselves than if you just tell them what to do. When you listen and try to understand their perspective without judging or pressuring, it can make it easier for them to find their own way. If your loved one is not adhering to their medication, you should also let their doctor know. Being a caregiver is rewarding, but can be quite challenging. If you need support or suggestions, please talk to your healthcare team to learn more.